we are in IFSO and we are going to talk about the magnet surgeon. So I'm going to introduce my interview. He's Dr. Michael Gagner. He's from Canada, Chief of Department of Surgeon in Westmount Square Surgical Center in Canada.
Yes.
It's very nice to meet you. It's very nice to talk to you.
Nice to talk to you as well.
So thank you for being with us. And what is magnet surgery?
Well, magnet surgery is we put two magnets to make connections. We have to make a connection between two pieces of intestine, the stomach, or the colon, or even the gallbladder, biliary. So these magnets are, some of them are ingested. You can swallow before surgery, and a couple of hours later, when we have an X-ray and the magnet is at the right place, then we operate to put the second magnet. And the second magnet is at another location, maybe lower on the intestine. And at surgery, by laparoscopy, we put them together. But the connection doesn't happen. It's just putting the two magnets together. And slowly with time, the two magnets will get closer and closer, and then they will make a connection while you're at home watching CNN. And then they pass in the intestine, and you can you have your connection, your bypass happening at home.
Oh my God.
Yeah.
So what is the benefit of this kind of surgery?
Well, the surgery is kind of delayed. You know, we do the setup of putting the magnets at the right place, and therefore there's no risk of bleeding. There's very little risk of having a leakage, which is the danger part of the surgery. So if we can eliminate the dangers of surgery, it's going to make it acceptable for a lot of patients. They will want to have these surgeries for all kinds of reasons, like losing weight, reducing the type 2 diabetes, or making diabetes disappear, or if there's a blockage somewhere, we can circumvent the blockage by using two magnets together.
So is that a bariatric surgery?
Yeah, if it's for weight, it's
yeah?
bariatric. If it's for diabetes, it's metabolic. But there are other types of surgeries, you know, that we make connection.
When you use magnet?
Yeah, we can use it in colon surgery to bypass a narrowing that's causing a lot of cramps, you know, like diverticular disease or other benign or cancer. We can do connections or bypass to help the patient.
Can the patient or a patient reject the magnet? Is that a possibility?
It's a rare possibility because the magnets, it's super magnets. They are made of neodymium, the rare earths, the rare earth.
Yeah,
so
rare
we need.
earth.
I know. I heard
rare
it.
earth here in Chile.
You discovered recently rare earth, so we can make these super magnets here.
Yeah, you're right.
Yeah. So then, but the neodymium can be toxic for the body. So we surround it completely with titanium. There's an encasement, and that becomes, the titanium is used for making hip replacements, hip prosthesis, knees. We use them for clips, staples.
It's safe.
So it is well accepted by the body. So we do a trick, is that we encase it completely with a nice metal.
What is the difference of this kind of surgery? Yeah, we are very close to the airport. So what is the difference of this kind of surgery and the other kind of bariatric surgery?
So in the more traditional surgery, we will use sutures or staples, but these are foreign bodies inside when we do the connection. And the connection heals with these foreign body in place. And so the connection is not as strong. It's much stronger when we have two magnets together, because the healing happens around the magnets. The tissue between the magnets die, but the healing takes place around the magnet, and there's no foreign body. So it's your own healing capability that gets enhanced, and that connection is the strongest ever. Strongest. It's a natural connection.
Wow, how do you see Chile in the development of this technology?
Well, Chile was one of the very first countries to approve the use of magnets in surgery. So now it's available. It's available in the centers that have decided to start these types of surgeries. So we've seen many hospitals and clinics in Santiago and also in Concepcion.
And also in Concepcion.
Yeah.
Close to the rare earth.
Ah, that great combination.
It's a coincidence.
Yes.
So let's talk about the obesity, because is this a good treatment for obesity? And I'm going to ask you this because we are talking a lot about the drugs or the surgery or one
Yes.
on the other.
Yeah. So with this new type of surgery, which means that the surgery doesn't happen right away, the patient can leave a few hours after the procedure. So the cost is very reduced. The patient doesn't need to spend a lot of time in the hospital or being watched for complications or having complications. So in my opinion, it is more cost effective than taking a drug once, injection every day or injection once a week for life. Now this treatment is like a lifelong treatment. So these connection with magnets is changing completely the huge profile of treatment of these diseases.
This kind of surgery are new for me. Yeah. So let me ask, can you live, I don't know, a lot of years with the magnet inside of your body? It's nothing going to happen?
The magnets are a temporary implant. They stay about 3 weeks and then they get naturally expelled
Ah, really?
in your intestine.
The magnet doesn't stay.
No, they stay 3 weeks. The time for the connection, and after that they move in the lower part of the intestine and they get expelled naturally. Naturally.
Oh my God! So it's a very good innovation.
Yeah.
How do you see the future of the metabolic bariatric surgery?
Yeah, a lot of people trying to predict the future. As you know, it doesn't always end up with a good projection. But I think right now people are talking about combinations. You know, drugs with surgery. There's going to be magnets with endoscopy, magnets with suturing inside the stomach, and like we did Tuesday was a combination. It was sewing of the stomach to reduce the size, and in combination we put a magnet between two portions of the intestine. They have an additional effect for long term or better treatment. And then you could add some medication, and maybe in the future we'll have implants that deliver the drug for 1 year. So all kinds of new treatment coming.
But nowadays, this surgery, it's in the cutting edge.
It's cutting edge surgery, absolutely. There are only a few surgeons in the world doing it, and here there's a concentration of Chilean surgeons doing it.
So now we are talking about this surgeon here in Chile. So what do you think, or what do you expect from this Congress?
Well, I expect, the people attended our session at lunch. It was full, standing in the back. I mean, people want to do these surgeries for their patients. They're so excited, but we have to train, we have to educate. We're just at the beginning. We have new implants for stomach, colon, and other parts of the gastrointestinal tract. So we're doing these trials in other countries right now, in Europe, in Middle East, in Australia, in the United States and Canada. So, but here for Latin America, Chile is in the forefront. We've started in Dominican Republic 2 weeks ago. We were in Mexico a month ago, and we'll start in Argentina next month.
Wow, so you're traveling a lot.
Yeah.
You're traveling. Good. So for me, it was very nice to talk to you. Thank you for teaching us about this kind of surgery. Yes. And what do you expect? What do you expect about this surgery? Because we need to...
It will go worldwide, and it will be a small revolution within surgery.
Yeah, but I'm asking specifically about policymaker, because we have to cover this kind of surgery, because obesity is not exclusive for people who can pay.
Yeah.
So what do you expect?
Well, I expect that this will be democratization of surgery, making it available for everybody. at a low cost, because that's, at the end of the day, it's how much does it cost and how many patients can we treat in 1 year. You know, surgery right now is only treating 1% of all the obesity patients.
Oh, wow.
So we need to go to, you know, 10, 20, 30%. Otherwise, we don't have an impact on the disease.
Exactly. So thank you
Thank
so
you.
much for explaining us about this surgery.
Great.
And thank you.
Okay.
I see you in the next one.